If people have nicknamed you the bad, then you're probably not something people want around. The bad seed, the bad apple, the bad cholesterol. That's what we call low-density lipoprotein, or LDL cholesterol, the bad cholesterol. And we definitely do not want too much of it lurking in our circulatory system, because elevated LDL is a major cause of heart disease.
When we discuss cholesterol, there are several different types of cholesterol. There's the good guy, the bad guy. The good guy is called HDL, high-density lipid. HDL is basically like a vacuum cleaner that goes around cleaning the walls of the blood vessels to reduce risk of atherosclerosis. It's a simplification, but that's the basic concept. LDL, low-density lipid, that's generally considered the bad guy. The LDL cholesterol is the one that actually deposits on the wall of the blood vessels. That's the one that statistically increases the risk of atherosclerosis, of hardening of the arteries.
Cholesterol is measured in milligrams of cholesterol per deciliter of blood, or milligram per deciliter. A high milligram per deciliter of LDL can be worrisome enough on its own. For example, someone with LDL numbers of 190 and above would be considered at high risk for heart disease, even if he doesn't have any other risk factor for heart disease. When we start considering other risk factors, we want to make sure our LDL numbers are even lower.
If you have one risk factor, let's say just family history, we might want the LDL to be less than 160. If you have two risk factors, say high blood pressure and family history, then we might want to get the LDL below 130. But if you have multiple risk factors, then we actually shoot and aim for an LDL below 100. And if you are the highest risk, diabetic, smoker, you've had some vascular disease already, so any sort of blockage in your neck, in your heart, in your legs, any atherosclerosis at all, we think there's evidence that the LDL below 70, which is very low, very difficult to do with diet alone. Almost everybody needs some medications to get that low. We actually can stabilize and melt plaques.
The good news is that studies show lowering LDL cholesterol reduces risk for coronary heart disease. It can be done with healthier lifestyles, more cholesterol screening, and efficient use of statin medications.
Many people, it is lifestyle related. And so if you're on the cholesterol medication and a year or two later you're able to improve your lifestyle, you really get motivated to go to the gym, you start some sort of realistic, safe diet, and then your weight comes down and you're exercising more, then by all means you can cut back the dose. It's helpful to meet with a dietitian perhaps to learn how to cut back on beef and dairy, how to substitute things that may be healthier in terms of fresh fruits and vegetables, and to go one-on-one with you to see what do I enjoy, what's palatable, what's going to work for me, that will help reduce my lipids, reduce my weight, and of course exercise will improve the lipids. With whatever diet you're on, you throw in a 30-minute walk and lipids in and of itself will improve.
With aggressive medications, good diet, sensible exercise, many people can reach these aggressive targets and have a better prognosis than we've ever seen. Yet, less than half of adults with high LDL cholesterol seek treatment. If you don't know what your numbers currently are, talk to your doctor about how you can find out. All adults should have their cholesterol levels checked once every 5 years. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.